My name is Taree Chadwick. I am currently in my second year of residency up here in Seattle, Washington. I'm a resident at First Hill Family Medicine, and I just started my second year about a month ago. So deep in the throes of that. But before coming up here, I moved up here for residency. So before that, I lived in Nevada. I went to med school in Reno, Nevada. And then between finishing high school and I moved out to Chicago for college, and I lived out in Chicago for about like 9 years before deciding to come back to school to pursue medicine. And then I ended up going to med school back in my home state. And that's sort of my path and where I'm from. I guess I would call both Nevada, Chicago, and now Seattle home. My current role in the AAFP is that I'm just, right now, I don't have a title or anything. I'm just a very active member. Previously, I had started with AAFP back in my first year of med school. I was on their school, on my medical school's family medicine interest group, and then became involved with the AAFP through that. Ended up taking on a role called the Family Medicine Interest Group Regional Coordinator, where I sort of help different medical schools connect, plan workshops, plan our now future conference. And then from that role, I ended up overseeing the entire country of those groups. And then from there, went even further and ended up on the board of directors of the AAFP as the student member last year, which was an amazing and life-changing experience. And in each of those different roles, there's a bunch of subset of roles too, being on commissions, being in mentorship roles, and planning different conferences and workshops and such like that. So that is sort of my journey, where I'm from, and my role with the AFP currently. I feel like I've told this story a lot, and I used it a lot, especially during like my medical school interviews and my residency interviews. But I come from a theater background. Both of my parents are in the art industry and in the theater industry, working in the field. And most of my family is in the art industry or just sales jobs and things like that. So first person in my family to go into medicine. And I realized a little bit later on, after high school, I went to college and I went and got my Bachelor of Fine Arts in theater production. I was working in Chicago I was there for 9 years. I think after college, I worked for about 4 or 5 years in the industry. I was working at the time at Blue Man Group in Chicago. I was behind the scenes doing like the wardrobe, doing the backstage crew work. And I kind of came to this realization that I loved the theater. It made me who I am, but I also was sort of kind of funneled into the theater just because of my background. And I never questioned it. I always thought, theater was the right thing for me because I loved it so much. But when I was working at Blue Man, I sort of had this feeling that there was something missing in my life and this deeper connection between other people and myself, and sort of this thought crossed my mind that I kind of want to leave. When I do leave this world, I want to make sure that I'm leaving an impact and I'm doing something that means something to other people. And for me, working in the theater, I didn't really get that direct connection to the audience because I was always behind the stage. And I think maybe it would have been different. It was if I was on the stage seeing the reaction to the audience members and hearing them laugh, watching them cry, but I didn't really have that. And I felt like that piece was missing for me. So I spent a lot of time trying to figure out what that looked like and what kind of path I should go down next. Thought for a while, maybe I wanted to be a teacher. Thought maybe I might work in nonprofit. And then my first experience in the healthcare industry was actually with a rural physician in West Virginia. I got to shadow him for a week, and he took me in the community and he took me on some house calls with him and worked in his clinic. And I sort of saw this direct impact that another human could have on an entire community and an entire family of generations or just one person. And it sort of like that felt like something I needed to do. And And then the rest kind of just fell into place. Like there's a lot of connections between theater and medicine. The community aspect, working within a team, trying to figure out creative ways to problem solve when you have limited resources, really connecting with other people, listening to their stories, telling your story. And then the thing that I found that I didn't know I would like was the just the constant learning that you have in medicine, which I didn't necessarily have when I was in theater. And I think that that sort of kept me going too, is there's always something new to learn and something more to gain. And so all of that was a very easy transition for me to make from theater to medicine. It just felt very natural. It kind of felt like home. And I knew as soon as I finished shadowing that physician that this is what I was meant to do. And this is what was going to keep me going and give me that goal of when I do end up leaving this world, I'll know that I have had that direct connection and hopefully made some impact in a community and in another individual's life. My first introduction to medicine was with this family physician, and it was a unique situation, definitely, because it was such a rural community. And I just remember, I think this was like the one thing that I vividly remember from that shadowing experience was we were in his clinic, and one of his well-known patients came in, and it was supposed to be a visit just for him, but he brought his mom, he brought his partner, he brought his kids, and then all of a sudden it was a visit for the entire family because this physician knew the entire family. And then not only that, but this physician also knew what this community needed and what this community was going through. And it's a coal mining town, so there are very specific needs that this community had. And I just remember this physician kind of telling me about why it's so important to be that person for a community who really needs it and who lacks a lot of those kind of frontline healthcare workers like him. And I think that experience, just seeing how much somebody could be a pillar in a community and helping people, was my defining moment. And then when I went into medical school, I kind of already knew that I wanted to be a family physician. But, like everybody does when they're in medical school, they sort of test the waters, they question, they do all the rotations and see what actually sticks. And there's always this saying about family physicians where if you kind of like everything, you go through every rotation and you like it, maybe family medicine's for you, because that's exactly what we do. We do a little bit of everything. And I was that person. I liked all of it. I liked delivering babies. I liked being in the hospital. I liked being in the clinic. I liked doing procedures. So that was another defining moment. There's also this saying that you kind of find your people. And when you find your people within a specialty, that's home for you. And I definitely found my people in family medicine. And I really connected, especially when I got more involved with the AAFP. They're just the people you lean on, the people you want to look up to, your mentors who mean something to you. So I think having that community too within the specialty has really solidified things for me as well. Every person's journey is so different and so unique, and you really have to listen to your gut. And I think as you move through your rotations in medical school, or even before medical school, when you're kind of seeking out those volunteer opportunities, it's really, at least for me, and I think for a lot of people, it's kind of that first exposure that you have to healthcare that gets you hooked, that sort of is your guiding light. And then I think you always need to stay open to opportunity and see what kind of speaks to you and what sparks you. And I think the biggest advice I have is that this field is hard. It's very difficult, and you have to find the reason why it means something to you and why you want to keep going when those difficult moments and those hard times come around. And for me, that's that human connection, that's being in the community, and that's sitting down with my patients and having a conversation about who they are and fighting for making them more healthy and our communities more healthy. And those things keep me going, and I can find those things in family medicine. I think there are people and there are students out there who find their passion and their why in the OR, and so then they go down that route and they find the specialty within the OR that keeps them alive and keeps them going and will get them through the dark times and even make the happier times even happier. And I think it kind of depends on who you are as a person, and you figuring out as a student and as a learner, like what means the most to you, whether that's procedures, whether that's being in the hospital, whether that's delivering babies and doing gynecological or family planning, whether that's cradle to grave, like what we do here in family medicine. There's so many different avenues, and just really exploring all of them before finding the one that really speaks to you and is going to keep you motivated to keep going. And I think the other part of that is finding that community within medicine that where you feel supported and you feel like you would gain the biggest community and support as you go through this journey. And I think if you find your mentors, you find your colleagues, and you find the reason why and the passion behind why you're doing it, I think that those things kind of keep you going. And that would be my biggest advice for medical students and pre-med students. I mean, there's a lot of speculation out there about like why family physicians and primary care have such a shortage, and it is really bad. We're doing everything we can to try to combat that. Personally, I think that a lot of the reason why there's this huge family physician shortage is because of the narrative around family physicians. And I think when you hear sort of mumblings and grumblings about, oh, family medicine, they get so burnt out, there's so much administrative work, they don't make enough money to pay back the debt, and you continue to hear that narrative about what family medicine is, it kind of gets stuck in your mind that that's not the specialty for me. But what we need to do, and I think especially what the AAFP is trying to do, is change that narrative. There are so many different aspects of family medicine that narrative is not true and not correct. We are actually one of the specialties with the least amount of burnout because you are able to change your career path up at any given moment. If you decide you want to go do palliative medicine, if you decide you want to implement more procedures, you want to actually be in the hospital, you can go work in the hospital as a family medicine doctor. Maybe you want to do that OB call, you can do that as a family medicine doctor. And because you're able to sort of do all these different aspects, that prevents burnout. I think another part of that narrative is the administrative burnout too. And, I think we kind of all have that administrative burnout. And I do think that in general, primary care in the clinic setting has a little bit more, but we are working very hard. There's lots of new AI technologies out there that are trying to prevent that type of burnout. I think that the narrative around the pay and not being able to pay back this large amount of debt we all come in with is also incorrect. There are many family physicians out there that are making 300K plus that are doing just fine. And there are lots of programs out there where you can get your loans repaid, although who knows what the future of that is, but hopefully those stay around. There's many opportunities to try to combat that debt and get you more money if that's what's holding you back. And I think that in order for us to get more physicians, we need to start at that pre-med and that med school level and change the narrative and start talking about how amazing family medicine doctors are and how amazing this field is, and the fact that it could take you anywhere, and that's quite unique from any other specialty. Yeah, the Be There First campaign from the AAFP is this new campaign we just rolled out not too long ago, but it is about showing students that family medicine is the first defense, and it is being that person that your patients first go to for information, to talk about your healthcare needs, to combat any disinformation, to form a connection, to talk about healthcare with your family. And I think for some people, it can be that first line of contact when there's an emergency. It can also be that first line of contact when you are planning the end of someone's life. It can be that first line of contact when a new life is born. And I think the AAFP is really trying to highlight that this role is extremely powerful, and we have work that is so meaningful. And by showing pre-med and medical students that we are here as the first choice and the first line of defense, messaging from the AAFP is trying to get more of the pre-med and med students interested in choosing us as a specialty and choosing us first as a specialty when they go to make their decision. You know, I've once heard, and I'm sure other specialties would argue against this, but I once heard from a very wise mentor that the family medicine doctor is the smartest doctor in the room because they know a little bit about everything. And I do think it's true, but it also makes this job extremely hard because there's so much to learn and you never stop learning. And I'm learning about all ages. I'm learning about all conditions. I'm learning about all different types of procedures. There are some family medicine physicians who will train in being in the OR, and I think I'm not doing that. But there are some family physicians who will do things that you wouldn't even think that they could do, and I think that is kind of serves as a base for why our specialty allows us to continue to grow and to continue to serve in meaningful ways, because we are the physician who knows so much about so many different people that we're able to position ourselves in the community to make a really impactful and meaningful change. I have found, especially in the last 4 years since I've been working with the AFP, that because of this role of being that pillar in the community, I have been able to see what a community needs, see what my patients need, and what they're missing, and then learn how to advocate for those things and really push to make sure that we're providing equitable care, we're breaking down barriers, we're giving the people who don't have the resources more ways to find resources so that everyone who is here can have that health care that they deserve and can live that healthy life that they deserve to live as a human being. And because we're also this pillar in the community, we have such a unique voice in advocating at our local level, at our community and state level, and even at the federal level. I've been able to go and talk to senators and representatives out in Washington, D.C., and kind of advocate for what I'm seeing back in my state. As far as medical education goes, and as far as healthcare and public health in my community goes. And I'm able to speak with a lot of breadth of knowledge because of where I'm situated in my community and in my role as a physician, as a family physician. And that's been a very unique experience for me that's allowed me to sort of grow. And definitely one of the ways in which I feel I make the most impactful meaning for my patients is not only just sitting there with them in the clinic and in encounters and listening to them and advocating for them in that way, but also being able to do it at a larger and more broader scale by going to, local representatives, community representatives, even up in Washington, D.C. on the Hill, and talking and advocating for what I'm seeing back in the clinic. And that is, to be honest, that's like probably one of the my favorite parts of this job, is just being able to have that role and being able to be there for my patients, and then being able to be a voice when maybe they're not able to do that themselves. I think my biggest advice that I always give to anyone who is questioning medical school is that, and even once you get into medical school, is that you are more than just your grades or a score on a test or numbers on a test. You need to find what makes you you and use that to your advantage. A lot of times people don't test well. I think that there's a lot of us out there who have test anxiety, myself included. I had to take the MCAT twice in order to get a score that was minimal enough for me to apply to medical school. And I I love being open and honest about that because I think that a lot of people out there don't hear that it's okay to not have wonderful test scores and wonderful grades. It's an important part. You can't obviously be failing your classes to get into medical school because it isn't competitive, but you don't have to have the most perfect GPA to get to where you want to go. Some schools, and maybe the school that's right for you, is one that looks at what your passions are, how you volunteered, how you've used your free time, what kind of research you've done. And all of those things, even your hobbies outside of medicine, all of those things are what make you you and what give you your voice. And you need to use that to your advantage and show it in your application, because that makes up for, in a large way, makes up for a lack of some of the best scores. And sometimes if you find the right program, they care more about that than the actual score that's on a piece of paper. The other advice that I'll give is that, kind of similar to what I said earlier, is just finding your community and finding your mentor. And finding the right mentor for you, or mentors, you can have more than one, is going to be really important, and is going to be kind of your light in this tunnel of trying to make it through, and the application cycle and the interview cycle. And when you're questioning things, you know to go to them, and they can lift you up, and they're a soft pillow to land on. And I think really finding that person or those people that that lift you up and bring you through the door with them is going to be really important for anyone going through this process. Well, the first place you should look is on our website, aafp.org. That is going to be your best resource. It has ways to connect to mentors or find a mentor if you need it. It has information about our future conference that's just for resident and students. You can even get involved as a pre-med student. It also has different learning opportunities you can seek out. It really is our one-stop shop for everything AAFP, and I'd recommend that first and foremost. But then we also have a bunch of different social medias out there you can access. AFP, or _AFP Instagram account. You can also look at the Future Family Med account, which is really highlighting our Be There First campaign as well.